Assalamu alaikum and good afternoon to one and all. Today we will start with the part 3 of general anesthetics. I am Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss classification and parameter to determine dose of general anesthetics and explain pharmacology of few important general anesthetics drugs. So let's start with the first part, that is classification of the general anesthetics. So general anesthetics, they are broadly classified it into inhalation gases and inhalation liquid. Okay, because sometimes liquid can also be converted into the gases and they can be also be given as a general anesthetics. Okay, so amongst inhalation gases we can use the nitric oxide. So nitric oxide, it is one of the oldest and still it is used as one of the good general anesthetic drug. So nitric oxides, it belong to the category of inhalation general anesthetics. Second category, it is inhalation liquid. So inhalation liquids, they are present in the form of the liquid and you are using vaporizer to convert it from liquid to gaseous form. So through gas although it is the liquid, but finally you are converting it into the gas and you are giving this drug as a gas to produce general anesthesia. So inhalation liquids are the ether, then halothane, N-fluorine, isoflurane, desflurane and sevoflurane. So the common thing from these drugs are they are ending with the suffix ane, right? So everyone like halothane, N-fluorine, isoflurane. So most of these drugs, these are halogenated drug. They are ending with the suffix ane. They are halogenated drug, means they having one or another halogen. For example, here there is presence of fluorine, isoflurane, there is also presence of fluorine, desflurane, again fluorine is present, sevoflurane, fluorine is present, but number of fluorine molecules and their position in the structure, right? At what position it is present, it is different in those drugs, and based on that it give different pharmacological activity. So general anesthetic, they are broadly classified as inhalation gases and inhalation liquid. Third important category, it is inducing agent. So we have seen different ideal property of the general anesthetics, especially for the anesthetician, to the patient and to the surgeon. So those ideal property we have seen in the last lecture. Now suppose any of these general anesthetic, if it does not having any of the ideal property, then to compensate that, you are using additional drugs. So those additional drugs you are using to get the good property of the general anesthetics or to produce ideal general anesthesia, so those drugs are called as inducing agent. For example, if one general anesthetic, it does not produces the analgesia, but it produces good and unconsciousness in the patient, so you can need to use the inducing agent as a strong analgesic drug. So analgesic drug that you have added to compensate the analgesic property of that anesthetic agent. Okay, so since you have added that to induce the smooth general anesthesia which is of surgical grade, okay, so you have added extra, so you call this drug as an inducing agent. Sometimes you add this drug to have the very quick process of analgesia or general anesthesia, because some drug they doesn't produces quick general anesthesia. So to have that quick general anesthesia, you are adding extra drug. So those drugs are also called as the inducing agent. So let's see the drug belong to the category of inducing agent. So they are further classified based on their onset of action. So the first category, it is the fast acting drug. So the inducing agent which having very fast action. For example, thiopental sodium, methoxytone sodium, propofol and etomidate. So these are fast acting drug. Now it is quite logical that since these are fast acting drug, means they produces very instant action. So when you are going to use this drug, obviously when in case of general anesthesia which does not produces the quick induction of the anesthesia, if it having the delay response, right? So that is not ideal for the anesthetician as well as for the patient. So in order to increase the speed of anesthesia, or in order to have very quick onset of the anesthetic action, you can add fast acting drug in case of the anesthetic when you are using anesthetic drug which are slow acting in nature. Okay, I hope you understood what is the use of fast acting drug and when to use it. So when we are using slowly acting general anesthetic drugs, so in order to quickly induce the anesthesia, you have added extra drug, and those are belong to the category of fast acting drug. So these are the thiopentone, methoxytone, propofol and etomidate. Second category, these are slower acting drug. So most of the time slower acting drug are not used to produce the quick nature of the anesthesia. It means you are using this drug in case of the general anesthetic which having their inherent property of quick induction and recovery. So those anesthetic drug on themselves, they are producing quick induction and recovery. So slowly acting drugs you are generally using to compensate other properties. So let's see what are those properties. For example, you are using here most of the benzodiazepines like diazepam, lorazepam, midazolam, right? So these are three drugs belong to the category of the benzodiazepine. So we already studied this drug in the sedative and hypnotics chapter. In addition to that, you are using ketamine. It is very unique anesthetic agent. Then you are using opioid analgesic like fentanyl or the morphine. So you are using it in case of anesthetic agent which having ability to produce the poor analgesia. So there are some anesthetic drug which produces the poor analgesia. So in that case, because analgesia it is required, because if a surgeon is giving the incision and patient suffering of the pain, then that patient will not be stable. So to induce analgesia in case of anesthetic drug which having poor analgesic effect, you can add opioid and fentanyl. So I hope it is clear to you, that is when we are using fast acting drug and why we are using slower acting drug as a inducing agent. So to remember that inducing agent, these are the drugs which are required apart from the pure general anesthetic drug, okay, in order to induce very smooth process of general anesthesia and also to compensate some of the property which is not there in the drug that you have selected for the process of inducing anesthesia. Okay, so I hope it is clear to you. If yes, then just quickly write yes, the first word of yes, why, in the chat box. Okay, so meanwhile we'll go ahead. So let's see about the inhaled anesthetics. So inhaled anesthetics, so most of the time they are either volatile anesthetics, means they are themselves volatile in nature. So even without vaporizer, they can be converted from liquid to vapor form. So either that possibility is there, so there is no need to use special vaporizer because they having volatile property. So we know that if any drug which is volatile, if you expose to the environment, the moment you expose to environment, that drug will be converted into vapor form. Okay, so either it is present in a gaseous form or drug it is highly volatile in nature, or it may be inhalation liquid. So if it is the inhalation liquid, or if it is present as a liquid at a room temperature and at a normal pressure, then in such cases you need to use the vaporizer. So you can vaporize this liquid anesthetic agent because they are present at room temperature and the pressure, they are present in a liquid form. But you cannot give the liquid through nostrils. Nostrils से आप liquid नहीं दे सकते हो, right? You have to convert this liquid into vapor. So you can use the vaporizer and vaporized it into the gases for administration. So always remember that most of the general anesthetics, they are given through inhalation route, because we are talking about inhalation general anesthetic, not an IV general anesthetic. So when we are using inhalation general anesthetics, they must be present in a gaseous form. So if drug has less volatility, or if it is present as liquid at room temperature and pressure, then you need to use specialized vaporizer to convert those drugs into vaporized form, or into to convert that liquid or vaporize it into the gases for administration through the nostril. Okay, so this is something which is the basic part of inhalation anesthetic agent. So you also need vaporizer in case of such anesthetic agent. Let's start with some historical anesthetic agent, that is nitric oxide. So nitric oxide, it is one of the very old anesthetic agent, and it is one of the inhaled anesthetic agent. Although it is very old, but still it is used as an inhalation anesthetic agent. Since it is very old drug, but still it is used, so it is called as the historical inhalation anesthetic drug. Okay, so drug, it is the nitric oxide. So formula of the nitric oxide, it is N2O. So it is present in a gaseous form, so there is no need to use the vaporizer. Okay, so whenever we are discussing these drugs, so what I have done today, we will be discussing about three important drugs of the anesthetics, which belong to the category of the anesthetic agent. Okay, and here we'll try to compare this drug with the ideal property that you have studied in the last lecture, and what are their advantage, what are their disadvantage, and if any anesthetic agent, if it having disadvantage, then how we can compensate that, or how we can overcome that disadvantage by using different type of inducing agent. So that is very important thing that you must able to understand as a pharmacist. Okay, so nitric oxide, if you see its property, it is a colorless, so that is the advantage. It is odorless, so that is also one of the advantage. And most importantly, it is heavier than air. Since it is heavier than air, it is not a light gas, right? Since it is not a light gas, it is a non-inflammable, so that it is going to give one more advantage. It is non-inflammable, and most importantly, it is very cheap. It means it is very cost effective. So especially in case of developing country where cost, it is the major parameter of the surgery, there you can prefer using the nitric oxide against using the expensive newer molecules. Okay, so it is the cheaper. So since it having all these ideal property, it is one of the commonly used general anesthetic drugs. So most of the time, due to this common ideal property, it is one of the commonly used, or rather preferred, general anesthetic drug. Let's see next property. It is how it is supplied. It is supplied under the pressure in the steel cylinder. Why it is supplied under the pressure? Because if we see their nature, it is heavier than air. Since it is heavier than air, and if you are not supplying it under the pressure, then movement of the gas become very difficult. So you need to apply particular pressure, and more appropriately, or more specifically, the partial pressure you need to apply in order to have the good movement of the nitric oxide from gas your cylinder where it is stored to your nostril, and from nostril to your lungs, and from lungs to your brain. Okay, so that part you have studied in case of pharmacokinetics of general anesthetics. Okay, so it is supplied under the pressure in the steel cylinder so that appropriate partial pressure can be maintained. In addition to this, since it is non-irritating, okay, drug, okay, so it does not produces irritation to the patient. So it is one of the ideal property that anesthetic agent should be non-irritating. But problem is that it having the low potency. Low potency means it doesn't produces the anesthesia at low dose. It means you need to give high dose of nitric oxide in order to produce the surgical grade anesthesia. Okay, so these are the property, and based on this property you can decide how to use this anesthetic agent. Let's see how it produces the unconsciousness, because that is unconsciousness, it is required for producing anesthesia of the surgical grade. So unconsciousness cannot be produced in all individuals. So that is the problem with the nitric oxide without concomitant hypoxia. So we have seen, if those drugs which produces or which take time in producing the general anesthesia or in inducing the general anesthesia, in those case of the drug, what we are doing, we are using carbon dioxide. Okay, so why we use carbon dioxide? Because carbon dioxide, it produces the partial hypoxia in the brain, and due to that it produces the dilatation of the cerebral blood vessels. And when there is more dilatation of cerebral blood vessel, the movement of the anesthetic drug from your blood to the brain become quick. Okay, so since in some patient it cannot produces anesthesia in those patients, so to speed up or expedite the process of anesthesia, what you are doing, you are using some mixture of the gas along with nitric oxide. So sometimes you are using carbon dioxide, sometimes you are only using the oxygen, depending upon type of individual to whom you are inducing the general anesthesia. Okay, so these are few property of the nitric oxide. In addition to that, the other property include it is a good analgesic drug. So now you tell me, the good analgesic drug, is it ideal property or not? Obviously, there are three important property that every anesthetic agents are required. So basic three important property. First thing is that it should produces unconsciousness. Second thing is that those anesthetic agents should produce adequate analgesia. And third thing which is required, it is adequate muscle relaxation. So these are the three important property every analgesic should possess. Since the nitric oxide, it is very good analgesic drug. So 20% of nitric oxide, you can see here, it can produces analgesia which is equivalent to that produced by conventional dose of the morphine. So it is so potent analgesic drug. Just 20% is able to produce analgesia which is equivalent to that is produced by conventional dose of the morphine. So what is the advantage here? There is no need to give the morphine or opioid analgesic as an inducing agent, because nitric oxide itself is the good analgesic agent. Okay, so that is the advantage of the nitric oxide. In addition to that, the problem is that it is the poor muscle relaxant. Since it is poor muscle relaxant, and we know that in case of the surgery, one of the ideal property which is required in the favor of the surgeon, it is very good muscle relaxation. Since it is a poor muscle relaxant drug, so you need to add neuromuscular blockers or neuromuscular blocking agent, so that the poor muscle relaxant activity can be compensated or can be overcome with the help of neuromuscular blockers. Okay, so in case of nitric oxide, if you look at property, there is no need to use a morphine, but since it having poor muscle relaxant activity, you need to add neuromuscular blockers as one of the inducing agent, right? Next part, its onset, it is the quick and smooth. So although its onset it is quick and smooth, but still in order to have much more quicker onset of action, you are using thiopentone. So thiopentone, we have seen, it is the fast acting drug. So you are using thiopentone so that although it having the quick and smooth induction of the anesthesia, but still if you use thiopentone, this speed can be further increased and you will get more quicker and smoother the smooth induction of the general anesthesia. Okay, so that is the reason why you have added thiopentone. So two inducing agent you need to add along with the general anesthetics. One, it is the neuromuscular blocker to compensate its poor muscle relaxant property. Second thing you are adding is the thiopentone as an inducing agent along with the nitric oxide, so that you will get very quick and the smooth induction of the anesthesia. Okay, recovery, it is the rapid, so that is the good and ideal property, because ideal anesthetic agent must have the quick induction and the recovery of that particular patient. Let's see what are the uses of nitric oxide. So it is generally used as a carrier and adjuvant. Now when you are using carrier, do remember that when you are using anesthetic agent which is highly potent. So if anesthetic agent, if it is highly potent, if you are using that, then in that case, to dilute its effect or to reduce their dose, because high dose may lead to toxic effect in case of potent drug. Okay, and surgical anesthesia can be converted into medullary paralysis and death of the patient. You don't want that. So to dilute their effect and to maintain anesthesia at third stage, that is the surgical anesthesia level, so you are using it as a carrier and adjuvant. Okay, so it can be, since it itself produces the unconsciousness, so at lower concentration you can use nitric oxide, and you can also add another drug as an adjuvant. Okay, so that is the first use. Second thing is that it is generally used as a mixture, and we'll see what is the reason why we are using it as a mixture. First we'll see how and what are the other gases we are adding along with this, or to how to produce the good anesthesia by using nitric oxide. So generally it is used as a mixture of 70% of the nitric oxide, then 25 to 30% of the oxygen you are adding, and 0.2 to 2% of another potent anesthetic. So in potent anesthetic which we are using here, we can use any other potent anesthetic agent, okay, and their concentration, if you look, it is very less. It is 0.2 to 2%. How you can able to reduce this concentration? Because here you have used the nitric oxide, it itself produces the anesthesia. Okay, so since nitric oxide it itself produces the anesthesia, you can able to reduce the dose of the other potent anesthetics so that you can maintain surgical anesthesia and there is no toxic effect in the patient. So the risk to the patient become less with the help of using this mixture. Okay, so most of the surgical procedure you are using this mixture of 70% nitric oxide, 25 to 30% of the oxygen, and 0.2 to 2% of another potent anesthetic agent. Now let's see what is the reason. So one of the reason is that nitric oxide, if you are using it as a sole agent means you have not used the mixture, you have not added oxygen, you have not added another potent anesthetic agent, and instead of that, instead of 70% nitric oxide, if you have used 100% nitric oxide, then problem with such use is that it having little effect on the respiration and the circulation. And we have seen that one of the ideal properties, especially for the anesthetician, is that it should have very less effect on vital organ. And respiration, it is very vital function, right? Respiratory system, it is very vital organ or very vital system. Likewise, blood circulation, it is very vital to the patient. So even little effect cannot be tolerated. So what you can do to compensate this effect on the respiration and circulation, you are using the mixture. Instead of 100% nitric oxide, you have used 70% nitric oxide, you have added oxygen, and you have added another potent anesthetic agent to get the anesthesia of the surgical grade. Okay, so by doing this or by using the mixture of this gas, the heart rate, the breathing and circulation are better maintained. Okay, and there is no risk to the patient. Since there is no risk to the patient, so it is better to use nitric oxide as a mixture rather than using it as a sole agent, especially for the most of the major surgery. But although it is used as a mixture, but in some cases you can also use it as a sole agent. So you can see in next statement it is mentioned that as a sole agent, that is the nitric oxide only. Okay, so N2O you are using at a 50% concentration with and 50% of oxygen you are using, but here you have not added any another potent anesthetic agent. So you here most of the time you have used the nitric oxide as a sole agent, but it cannot be used for the major surgery. It can be used for the minor surgery, especially like the dental surgery, for the teeth, or obstetric analgesia. What do you mean by obstetric analgesia? Analgesia which is generally required especially during delivery of the baby. While baby it is delivered, the mother suffered from the pain. So at that time when you need to give the anesthesia, or if you are the mother, it is undergoing the surgical procedure. So and the baby it is there in the mother womb. Then to avoid the effect of any other drug, you are using only nitric oxide. Okay, so you can use the nitric oxide because there is just few incisions are required for delivery of the baby. Okay, so it can be used also for obstetric analgesia as a sole agent, but for the major surgery you are always using nitric oxide as the mixture. You are not using it as a sole agent. Okay, let's see what are the advantage of nitric oxide. So nitric oxide having many advantage. First important thing is that it is non-toxic to the liver, kidney and the brain. So that is what needed. So this is the ideal property for the anesthetician. It is not affecting the major organ. Second important thing is that the metabolism of nitric oxide does not occur. Since metabolism of nitric oxide does not occur, it means whatever dose you administered, it is used to produce general anesthesia. So anesthesia can be easily predictable. It is not much variable from patient to patient. Okay, so metabolism does not occur, so that is another advantage. Third thing is that it can be quickly excreted through the lungs. Means if you have administered the anesthesia and if you want to recover the patient, then simply you stop giving nitric oxide. Now channel of administration become channel of elimination. So the drug which was now there in the brain, now it will come in the blood. From blood it will come to the lungs, and from the lungs through exhaled air it will be taken out of the body. So it can be quickly bring out from the brain due to its quick excretion through the lungs. So that is the advantage, and that is the reason why nitric oxide can able to produce the quick induction and the quick recovery, because it does not produces the metabolism and excretion. It is also very quick through the lungs, so the recovery of the patient become very fast. So I have done with first part of my today's session. So before going ahead, let's have the quick question and answer session. So my first question is, give example of one inhalation liquid anesthetic agent. We have seen 4 to 5 liquid anesthetic agent. I'm expecting every one of you give different examples so that all inhalation liquid anesthetic agent get clear. Okay. So I'm waiting for your answer in the chat box. So let's see who give first answer. Okay, very good answers coming started. So Sadia has given the first answer. She has mentioned that it is the isoflurane. Very good, Sadia. Kais mentioned about the ether. Nazir mentioned about the ether. Very good. Then Anjali mentioned about the ether and halothane. Sevoflurane someone has mentioned. Very good. Enflurane. Shifa mentioned about the enflurane. Very good. So Anjali again mentioned about the desflurane. Okay, so we have covered most of the inhalation liquid anesthetics. So we have seen 5 to 6 inhalation liquid anesthetics are there, which are generally present in the liquid form, and you have to convert it into the vapor form in order to induce the anesthesia. Second question, enlist parameter to determine the concentration and dose of inhaled anesthetics. Enlist the parameter to determine the concentration and dose of inhaled anesthetics. So what are the parameters to determine the dose of or inhaled anesthetics? Yes, what are the different parameters to determine the dose and concentration of inhalation anesthetic? So we have seen few parameters. Let me see who give the answer. Do you think volume is one of the parameter? Volume, partial pressure? Yes. If you are agree, then just write Y in the chat box. Okay, Sadia mentioned that it should be liquid at room temperature. I am agree, but how we are measuring the dose? Because concentration cannot be measured. Amina mentioned about mixture of different gases. So what is the main parameter to measure the dose? Yes. So Aditi mentioned about vapor pressure. Very good. Aditi, so vapor pressure we have seen. So pressure plays very important role to decide the dose. Because more is the pressure, more dose you are giving for anesthetic agent. So partial pressure, it is one of the major indication of the dose of the anesthetic agent. Okay. So that is one of the important parameters, and many other parameters are there which can be used as to determine the concentration and the dose. But most important parameter, it is the partial pressure. Third question is, why nitric oxide is used as a mixture of gases for most of the surgical process? So just now we have seen that answer. Why nitric oxide is used as a mixture of gases for most of the surgical process? Come on. What is the reason why we are using it in a mixture form, why we are not using it in its original form, or why we are not giving 100% nitric oxide? So let's see who give the first answer. Yes, I'm waiting for your answer. So Kaif has given, because he has mentioned about heart rate, respiration and circulations are affected. Very good, Kaif. Has effect on the respiration. Okay, so there are two important reasons. First is that it affects the respiratory system. Second thing is that it is affecting the blood circulation. Although effect it is little, but still, since these are the vital system, even little change in the respiration and circulation cannot be tolerated. So what you are using the mixture of, you are seeing the 70% of the nitric oxide, we are using oxygen up to some percent, and 0.2 to 2% of other potent analgesic agent, anesthetic agent we are using. Okay, so very nice. So you should be very quick in giving the answer, because your answer it is recorded as this YouTube analytics of your comment is also recorded on backend. Okay, and that will be counted while giving the marks. Okay, let's move on to second anesthetic agent. Now we have seen in case of the nitric oxide. Nitric oxide, just quickly I am revising that it is the ideal property is that it having very good analgesic property. But problem is that it does not produces good muscle relaxation. So you need to add the inducing agent or neuromuscular blocker to induce that muscle relaxation. Okay, so it is generally used as a mixture form. It is not used as an individual drug. Let's see second drug, that is the ether. Let's see what are their advantage and their disadvantage and how we can compensate that. Okay, so let's move on to the advantage of the ether. So advantage of ether is that it is the potent anesthetic agent. Now since it is the potent anesthetic agent, so you are exposing less amount of drug to induce the anesthesia. That was not the case with the nitric oxide. Nitric oxide, it is not that potent anesthetic agent. So this is the advantage with the ether. Secondly, that it produces the good analgesia as well as muscle relaxation. So since it produces the good analgesia, do we use analgesic agent? Obviously, there is no need to add extra analgesic agent to induce the analgesia, because ether itself, it is the very good analgesic drug. In addition to that, since it having muscle relaxation activity, so most of the time during to induce the anesthesia, every time you are adding muscle relaxant drug. But when you are using the ether, since it having the good muscle relaxant property, the dose of muscle relaxant can be reduced to 1/3. Okay, so neuromuscular blocking agent that you are using, so their dose can be reduced to 1/3. So there will be the less risk to the patient, and the less toxicity will be produced by the ether. So now these are the advantage. Now before going ahead, let's quickly see the structure of the ether. So ether, it is very common molecules. You might have studied this many times in the chemistry. Like it consists of the two ethyl molecules. So this is the first part of the ethyl molecules, and this is the second part of the ethyl molecule. So it is basically diethyl ether. Okay, and these two ethyl molecules, they are joined by the oxygen molecule. Okay, so that is the reason why we call it the ether. So ether on the both the side, the alkyl group is present, and it is the alkyl group, it is joined by the oxygen molecule. So if this compound is there, that is called as the ether. So basically we are talking about diethyl ether. We are not talking about other ether. Other ether, they may not having this type of property. Okay, so when we talk about anesthetic agent, and that is ether, it is basically a diethyl ether. Let's see what are the disadvantage of this and how to overcome this. Okay, so disadvantage is that it is highly volatile liquid, and it produces irritating vapors which are inflammable and explosive. Now since it is highly volatile, obviously any highly volatile liquid, it is quickly converted it into vaporized form, and such liquid are generally inflammable and explosive. Now if they are coming in contact with the fire, it may lead to bigger fire if it is just coming in contact with even small fire. Okay, so it may lead to the explosion, or it may lead to the catching of the fire. So you need to take all the precaution, and you have to see that the fire, it is not catching, because inflammable and explosive property, it is not ideal for the surgeon as well as anesthetic agent, because that is generally risky. So you have to take special precaution while giving diethyl ether. Second thing is that since it is highly irritating, so any liquid which is irritating in nature, it produces the more secretion in the body. Like irritation when you are giving through the nasal cavity. So anything which is irritating into your nasal cavity, so first thing happen is that you start sneezing. Then if it is irritating into your mouth, it will increases the secretion of the saliva. So there will be more mucus as well as salivary secretion. It is happen due to irritating property of the ether. Now how to overcome this? Obviously for inflammable and explosive property, you can use stainless steel apparatus, stainless steel cylinder to store it, so that unnecessary exposure to the environment can be easily controlled. Okay, whereas in case of irritating vapor, to avoid unnecessary secretion, what you can do, you can give atropine as a pre-medication. So when you are using atropine as a pre-medication, what is the property of atropine? Atropine, it is anticholinergic drug. It reduces the salivary secretion. Okay, so when you are using atropine, then you can easily prevent patient from drowning in his own secretion. Now what happens when anesthesia is induced and there is excessive secretion? Why you don't want excessive secretion? Why anesthetic agent should not produce vomiting? Because once anesthesia is induced, the patient is unconscious, and unconscious patient doesn't able to expel content from the mouth. Suppose there is excessive salivary secretion, it is there in your mouth as a conscious person. What you will you will do, you will go into the washroom and you will expel that secretion, or you will spite off. Okay, and if there is vomiting, then there's vomitus, the content of vomiting, what you will do, you can expel it out. But since patient it is unconscious, he will not able to do, and that secretion, it is generally accumulate in your mouth, and that may go into the lungs, and it may lead to the drowning of the patient. Okay, so to avoid this excessive salivary secretion and mucus secretion, you are giving the atropine as a pre-medication along with the ether. So you are using it so that you can able to overcome the effect which is happened due to irritating property of the ether. Next important thing is that it is highly soluble in the blood, and we have seen in case of factor affecting induction and recovery that if drug it is highly soluble in the blood, then how it is going to affect induction and recovery? So highly soluble drug, it take more time for the induction. So induction it is prolonged, and it will take more time for the recovery. So recovery it is slow because these drugs are highly soluble in the blood. So it is not an ideal anesthetic agent. In addition to that, it produces the post-anesthetic nausea. Means after anesthesia, it produces the nausea, and in some patient, it also produces the vomiting. So, at looking at the properties, some of the property are ideal, some of the property are not good for the patient. So, if you have some other drug which can overcome the disadvantages of the ether, then those drugs are one of the preferred drug. So what you are using, especially in case of developed country where they can afford use of the newer anesthetic agents which are quite expensive, then in those country we are not using ether as a general anesthetic agent. So it is not used in developed country due to its unpleasant and inflammable property. But at the same time, since it is very cheap in nature, it is available at very inexpensive rate. So in case of developing country where the patient doesn't afford expensive anesthetic agent, it can be used. Why we are using this in case of developing countries? So first reason, it is a cheap. It is available at a very low cost. So surgery cost, it is going to be reduced. Ka budget kam ho jayega, okay? Second thing is that it can be given by open drop method. We have seen 3-4 methods. One of the simple method, it is open drop method. So it can be used by the open drop method because it is the cheap. So even waste is there, so that can be afforded. Okay. No need to use any equipment if you are using the open drop method. I hope you all are agree with me, because in open drop method you are simply using the mask, and drop by drop you are dropping anesthetic agent. Third important thing is that it is relatively safe. So even if it is given to inexperienced hand, or even the anesthetician it is inexpensive, then it is not going to produce any problem to the patient, because even excess dose does not lead to medullary paralysis and death of the patient. So it is relatively safe. So even in inexperienced hand it is safe. So that is the reason it is used in case of developing country, but it is not preferred especially in case of developed country. Let's see another inhalation anesthetic. So we'll be seeing one more inhalation anesthetic and then we will stop. Okay. So third drug, it is the halothane. So halothane, it is a liquid anesthetic agent, and it is halogenated, and it contains fluorine. Okay. So it is the first halogenated ether. So basically it is ether, but instead of alkyl group, you can see all group of fluorine. So 3 fluorine molecule, 1 chlorine molecules, and 1 bromine molecules. Okay, it is there instead of the ethyl group. Okay, so you have just changed the group. Now drug become a fluorothane, or it is also called since it contains halogen, so it is also called as the halothane. So all those general anesthetics which are halogenated, since they are halogenated, that contain halogen, they are called as the halothane. Okay, so it is the first halogenated ether. What are the advantage? It is non-inflammable, so it is the ideal one, non-irritating, volatile liquid with sweet odor. So essentially, since it is non-irritating, it is volatile, and since it having sweet odor, so patient can happily take this anesthetic agent. So the anesthesia become pleasant to the patient if you are using the halothane. But it is a potent anesthetics. Another advantage is that it is potent anesthetics, so you can precisely control the anesthesia whenever you need. You can induce anesthesia and also induce the recovery of that particular patient. But problem is that it is not a good analgesic, and it is also not a good muscle relaxant. Now any drug which is not a good muscle relaxant, what you are doing, you need to use competitive neuromuscular blocking drug, so that muscle relaxation can be produced. So when you are using halothane, you need to use neuromuscular blocking agent to induce muscle relaxation, and you need to add some morphine or fentanyl as an analgesic drug, so that analgesia can be induced. Okay, so this is in case of the halothane. Let's quickly see about pharmacokinetic, because it is little uniqueness there in pharmacokinetics of the halothane. First thing is that the 50% of the halothane, it is metabolized by P450 enzyme. So this is one of the enzyme in the liver. For GPAT point of view, it is very important. The halothane, it is metabolized by the P450 enzyme. You must remember that. Okay. Second important thing is that it induces hepatic microsomal enzyme. Now, since it induces hepatic microsomal enzyme, it speed up its own metabolism. So you need to, when you are using the halothane for longer period of time, you need to increase the dose of the halothane. Okay. A third thing is that it releases the chloride and bromide after its metabolism. So once the metabolism is done, it's breakdown, okay, and there will be release of these halogen into the body, which is generally not safe. It is not going to be safe for the body. Okay, so what are the side effects? Since these halogens are released, it is going to affect your heart. It produces myocardial depression, where especially the depression of the SA node. It also having the effect on the liver, that it produces hepatotoxicity, and it produces malignant hyperthermia, where the patient suddenly their body temperature it is occur, body temperature it is increased. Okay, so that is called as malignant hyperthermia. So malignant hyperthermia, it is also occur, but it is very rare, and it is seen in case of genetically abnormal people. But although it is seen in genetically abnormal people, but it's one of the important side effect of the halothane, and that is the reason now halothane it is replaced by another halogenated general anesthetic agent. Okay, so in next lecture we'll be seeing few more anesthetic agent, so at least you are in position to compare and contrast different anesthetic agent, and you must get at least broad sense of how we can use anesthetic agent, what drug can be added, and why we are adding other inducing agent with the anesthetic agent. Okay, so thanks for watching my session. I refer KD Tripathi textbooks. I must thanks to the author of this textbook for providing the wonderful information on this topic. Okay, I will be releasing the question and answer link in the chat box. You give me a 2 minutes to release that. So once again, thank you very much for watching my session. For more such learning, subscribe to my channel, and if you like my session, then do remember to give me a thumbs up. So there is second quiz and your attendance link. I am releasing it in a chat box. Okay, it will be activated for 10 minutes sharp at 3:30, and so I am going to close this link. So I am expecting that all of you are giving attendance by 3:30. So I already released this in a chat box.